Endoscopist, the key strategies for effective mentorship.
Bismillahirrahmanirrahim. So regarding the mentorship, which is a very important topic that we were very careful to put in our program, because we received mentorship from great mentors. So we wanted to give back this to our younger colleagues. So what is the shaping, how to shape the future endoscopists? What are the key strategies for effective mentoring? So defining mentorship, what is mentorship? Mentorship is defined as the process of guidance being passed from one individual with more experience to another with less experience. It has been considered as a core component across all medical and surgical specialties. The concept of mentorship has been existing for centuries, and it is accepted as the academic principle to learners and faculty. Especially at medical schools, residency, fellowship applicants, they look for guidance and to enhance their chances and to achieve their goals. So formal mentoring programs and increased the popularity of individual one-to-one mentorship. The historical background of mentorship goes back to the mentor, which was the advisor of in the Odyssey of Homer. This guy is the one who took care of the Odysseus' son during the Trojan War. So he was called a mentor, that was his name. So the mentorship came after his guidance to the young king. Evolution of mentorship over the last decades, we have watched mentorship evolve from an organic connection between two individuals who may share similar goals, vision, interest, assignment, to a more structured process that was initially assigned in the workplace and helped certain groups to become aware of accustomed professional politics. It is also was used as award giving for the mentor and promotion decisions that consider how many individual a candidate can mentor in his work time. Accordingly, we have seen an increase in individuals desiring to be mentors across the medical profession. So what are the mentorship benefits for mentees? First of all, career guidance, specialty selection, career planning, networking, skill development like clinical skills, research methods, communication, and also psychological support, confidence building, resilience, avoiding burnout. The leader, what are the benefits for the mentor? So both sides get benefit. So for the mentors, they have leadership skills development like teaching, communication, organizational growth, professional satisfaction, giving back, the feel of satisfaction to give back to others, shaping the future of medicine, participating in changing the future of the medicine, and also academic advancement. Also, they can get opportunities in research collaboration and publications. So mentorship, especially in gastroenterology and endoscopy, can be very challenging. Why? Because in GI, we need training. We need complex procedures training. We have long learning curve. We have different fellowship programs like Dr. Nasish explained. She forgot one program. I will tell you about it today. Okay. So, and endoscopy training and research mentorship, professional ethics as well. The types of mentorship in GI, they can be either clinical, like procedure-based guidance in the endoscopy room or in the hospital, in the bedside teaching, or academic mentorship, like helping the mentee in research designing, publishing, presenting, or professional mentorship, like career decision, leadership roles, and also soft skills. What are the impact of mentorship on the future of gastroenterology? Why do we need mentorship for the patients? So we have improved patient outcomes, correlation with better procedure competence, high research productivity, and reducing attrition and burnout. So what happens when the mentee meets the right mentor? And we have here to define what are the right mentor. So this is a real life example. This is a short term story of my life. This is me. I met Professor Dr. Wahid Dos, who helped me to travel to UK under Dr. Mutawfiq. I learned some of the basic endoscopic techniques, screening for colorectal cancer. I worked a lot in the BSG, and then he helped me once again to go to Germany. I've met Professor Schumacher in Essen, Professor Gerges in Essen, Professor Ibekbo, and then I went to Augsburg. I met Professor Messman and Professor Raha. Okay, through this mentorship example, there is a mentee and a mentor, which equal the product. What are the products that I brought after all this mentorship? This is what I achieved. I was accredited from my own hospital and my own institution. We created the program for WEGE, Women Empowerment in Gastrointestinal Endoscopy. I started third space endoscopy, and I published a lot. I went through many courses. I was accredited in the WEO Emerging Stars program, and I had many certificates in my trainings. I published a lot of papers. So, are there barriers or is it easy? What are the barriers for inclusive mentorship? So, is the mentorship inclusive or exclusive for some people? We have to be careful because there are several barriers prohibiting inclusive mentorship to be accepted. These barriers can be centered upon the mindset of the mentors and the potential obstacles of being in a relationship with a mentee of a different background. So other barriers can be the time constraints, because the mentor is usually always busy, the clinical workload for the mentee and the administrative burden, the mismatch of expectation. If the mentor is expecting something or want to teach something, but the mentee needs another thing. He needs different needs. He has different goals. The lack of training for mentors. Mentors sometimes think they only can be mentors natively without having any training how to mentor others. But this also needs training because you have to submit to the mentee's needs first before you want to mentor him. And the need for structured mentor development programs. As Dr. Nazic said, there is a lot of examples like international societies, international grants, training programs. In the ESGE and the WEGE, WEO, WE, there is a protected time recognition initiatives, formal programs, structured goals, accountability, and feedback loops, which are very, very important to elaborate and rebuild another program that is accustomed to the mentee needs and tailored to the mentee needs. The e-learning and the video learning, the visual mentorship, virtual mentorship, and the international collaboration. This is the program also in ESGE. Okay, I am a member in this mentorship program, which collaborates and gather people from different parts of the world to mentors from other countries around the world in the same specialty. What we basically designed in this program is that we had a questionnaire for the mentee. What do you want? What do you want to learn? Do you want to learn soft skills and decision making? Or do you want to learn something technical in ESD, ERCP, EOS? Or you just want balance, work social life balance? Okay, what exactly you need? So based on this questionnaire, we match it with the mentor capabilities. If the mentor is very much specialized in ERCP and he met a mentee who only needs AOS, then it's a mismatch. They will not benefit from each other. So remote mentorship, it has two effective approaches, okay? Digital communication is increasingly central. Remote mentorship has become more relevant than ever. Although we encourage face-to-face meetings during congresses, but a stronger mentor relationship can only be built and maintained even without physical proximity. The natural process of mentee-driven support, this is the first approach. It is a mentee-driven support. As I told you, we take into consideration what the mentee needs. So the mentee here will take the lead, identifying areas where the support is needed, and he asks the mentor for it. It is flexible and tailored to the mentee pace and needs. It also, the mentor role here is to listen, ask thoughtful questions, and provide directions. The other way around is a mentor-derived approach, where here the mentor will take the lead. The mentor will help with planning, setting milestones, and giving feedback to the mentee. This approach is especially useful when a structure is needed and when the mentee is learning something new, so he doesn't really know exactly what he wants. So, solutions for effective
Sorry, Dr.
mentorship.
Shimaa, we are out of time.
Yes, I'm finishing. خلاص. So, good structure and open communication and cultural sensitivity is very important in selection. As we said, we already put the roles for the mentor and the mentee, but soft skill focused assignment also include communication practice, teamwork and collaboration, time management, conflict resolution scenarios, networking goals, and shadowing with reflection. Unofficial assignment, can we give him a personal statement drafting, career path exploration, observation of leadership, and building his portfolio and daily journaling. We spoke about this. So what are the future directions and takeaways? Creating a culture of mentorship in GI, embedding mentorship and training philosophy, closing thoughts and call into action. Everyone can be a mentor, invest in the next generation. My take-home message today is mentorship is defined as a process of guidance being passed from one individual with more experience to another with less experience. Mentorship in medicine and GI needs collaboration of national and international organizations. The ECG mentorship program is offering diverse and equal chances for those who have the need for mentorship from all over the world. Mentees are the core and the base of any mentorship program according to the needs and their goals. So, the message to the mentee is be yourself, your needs and your goals, define them very well, and you will easily find your mentor. And thank you so much. And the old Egyptians were the first mentor in the world. Huh? Thank you.